So I got involved in disease clusters because of a cluster that was actually in my hometown, Victor, New York, several years ago. And my best childhood friend's mom died of brain cancer. It was a rare glioblastoma. And there were in fact 3 brain cancers on her street. And so it was pretty clear that there was something amiss. And it turned out that there was a TCE exposure in the water source. And it was both coming up through vapors into the homes and also into the water supply, into the well water. What I learned from this is that the public officials were not really prepared to be able to deal with this kind of issue. I also learned how divisive it can be for a community, in the sense that people were very concerned about the value of their homes, what was going to happen, would anyone ever want to live in this neighborhood. I think one of the challenges of disease clusters is that it's not any one agency's responsibility. And so if it's no one's responsibility, no one is accountable and there is no action. So NDCA is able to hold agencies accountable, but what really needs to happen is we need a lead agency, both at the federal level and at the state level, that really feels responsibility to deal with disease clusters. So when a community calls with a concern, it's not greeted with, well, we'll pass you over to here and they'll pass you over to there, or we don't have the staff to be able to respond. It's greeted with a swift response, supportive.
I have hope that we can call attention to what systems are broken and one by one fix them and make it so that, you know, we already have the health tools that we need. We do a good job with infectious disease control, foodborne disease outbreaks, and it's time to raise the bar of public health so that we're doing a good job preventing chronic diseases. You know, linking environmental exposures to diseases is admittedly a really tough job, but that we can do it. So we have the tools, and you know what's kind of lacking is some of the political will, but really with NDCA calling attention to this, and with you know, so many community, I think 1,000 communities a year are reporting their concerns. I think we're reaching a tipping point. So I just want to have a shout out for hope and optimism that even though this task is